Hello my lovely darlings, I am making this video because I think this information should be a lot more widespread. I feel like a majority of dog parents still don't know about this, and because we recently had another scare with Nova, she had her third it's the most invasive surgery she's ever had. The first time she went in, they weren't quite sure what the issue was, and she had to go back in months later because they didn't suture it properly. It was another doctor before, and he's retired now, and now there's a newer doctor. She's younger and she's really good. Apparently she's one of 22 vets in the entire world with her special specialization in I think it's called oro. I can't remember the name of it, but she's highly specialized, and she's the one who has operated on Nova twice now. So now they realize that what she has is called osteomyelitis, something like that. Basically, it's a recurring bone infection, and despite popular belief of gum infections, periodontal disease, it's not always caused by lack of brushing, because we have been brushing Nova's teeth quite regularly most of her life with regular brushing, but this disease was not caused by lack of brushing. We've always been quite diligent about that. There are people that go years without brushing the dog's teeth. I don't think we've ever gone a full month without brushing her teeth. And when we noticed halitosis, bad breath, and then teeth sensitivity, the only reason why I ever realized there's something wrong with her teeth is if she's licking and she's kind of wincing, you can tell it's kind of uncomfortable, and then her breath starts smelling really bad, especially because we brush her teeth quite regularly. Her breath does not smell. So when it starts to smell, we realize there's some sort of infection going on. And then we had her checked out. First time was at the end of 2023, almost. Yeah, it was around 2023, 2 years ago. And that's when they found the first tooth fracture. So I'm trying to tell you guys that this issue is caused by a fracture, a hairline fracture in the tooth, and you can't see it. Hairline is so fine. You don't have loops, you don't have those really highly magnifying glasses to be able to see. So this is what's really scary about this infection, is that it's caused by a fracture or a crack in the tooth, and you don't notice obvious symptoms in your dog until it's quite advanced, and then it requires tooth extraction. So she has very few teeth left. Last extraction was 8 teeth, and then this time was 7 teeth, and it was just, it's quite horrible because it comes back and it can spread. So what happened the first time was it took out almost all her right side. Now she's got no teeth on her right side, and the only teeth she has left are on her left side. This one was particularly invasive because they took out her main bottom canines. Those are big teeth. Those are the longest rooted, deeply rooted teeth that dogs have. And I could tell now she's trying to get used to eating things. Obviously she's got to eat soft food on for 14 days. And I've read online that dogs without teeth don't live any shorter than dogs with teeth. It's healthier for them not to have any infected teeth and no pain, and it's not life-threatening. It's life-threatening if you don't do anything and you allow infection to fester in your dog's mouth. So the sooner you can extract, the better. So anyways, I just want to warn you guys, she's had, the first one was caused by a fracture. The infection went away, and somehow she got another one. So I don't know if we didn't throw out all the Benny bones or the Nyla bone and she found one, whatever. We don't have them in our house anymore. But ever since her last ever since she's had the second infection, she wouldn't touch them anyway. Like, Mello has a few Nyla bones, but they're so large, like Nova doesn't touch them. So we just purchased a whole bunch of gummy bones. So the oral surgeon said, if you cannot dent a dog chew bone with your fingernail, it is too hard. Therefore, it is dangerous to their teeth, and cracked teeth are really common with all breeds and these type of bones. And I think perhaps it's just not as known because people either don't know. You're not going to know. Her teeth looked fine. Sure, a few were a bit like, you know, could use a brushing. Sometimes you get stains and stuff like that. But her teeth looked overall fine. And then you realize they're not fine because there's a fracture somewhere and you can't see it. And like I said, you can't tell obvious symptoms until it's really advanced. And then they basically had to go into her like dental skeletal bone, because you know your teeth are like part of your skull. They had to debride her bone, so they had to like take chunks out of her actual skull, like underneath her gums, because the infection is not just with gums, it affects the teeth, the gums, and the bone underneath. Like, it's so scary, and it just breaks my heart to know that she was in such pain. And I was trying to brush her teeth all the time, thinking it was just like a gum infection, like it wasn't, you know, because usually if it's just periodontal disease in the early stages, because my mum, she's an orthodontist, right? So I know somewhat about teeth because of her, but she told me that in early stages of periodontal disease, gingivitis, you can reverse it if you start brushing your teeth regularly. So I thought that was it with her. So I just started brushing all the time. And you could tell she was so uncomfortable and she wouldn't let me touch certain areas. And that's when I was like, we need to take her in because that's not normal. Because she likes brushing her teeth. I've conditioned her since she was a puppy. She likes brushing her teeth. But then there's certain teeth that she wouldn't let me, it's not like she doesn't let me. She's so good and she's so tolerant, but you could tell it was hurting her and she was just trying to avoid me brushing certain areas of her mouth, and that's when I knew there was something wrong. So anyway, a few days ago, today is her second day at home. So she came home the day of her surgery. Was Tuesday, it's Thursday, so Tuesday morning she went in and then she was there all day, and then my mum picked her up around 6. So, and then the anesthesia was wearing off, and we've been through it before, so we knew how to take care of her. She's such a terrible patient because she's so like, no, I can do it. I don't want your help. She's so independent, right? So she's trying to run while she's drugged up. So she's like almost walking into the wall because she's trying to run. And then she's jumping off the sofa and jumping off high places, and she just cannot understand, like, why the fuck am I so doozy? I don't understand why I'm like all over the place. She was high as a kite and she was like still trying to do her thing. But anyway, dogs, from my experience of the times that she went under anesthesia and had these major surgeries, like getting 7-8 teeth extracted each time is a huge deal. Like it's a lot of teeth. And like the times that like she went in and then we take her home, they recover in like a day or two. Like she is, you know, consider it, when we took her home, she was like 0. She's like 95% on the second day. Like dogs heal and recover a lot faster than humans. Like it's insane. It's almost like, considering how invasive her surgery was this time too, it was a lot worse, because last time she recovered in a day, the next day she was like jumping around, she was just like nothing ever happened. This time, because it was so much more invasive and a lot more major teeth taken out, like especially the 2 front canines, like those are like the main teeth of dogs to chew, like the teeth, like they chew in the back too, but the main canines they use a lot, you know, they're like utility teeth. But anyway, she doesn't have them anymore. And her underbite, because all pugs, brachycephalic breeds, have an underbite, and that actually maintains her structure of her face. So it hasn't really changed. Her face hasn't changed. That's so lucky, because like when humans do not have teeth, the entire face just collapses. Like the teeth are the things that keep your face structured, but dogs are lucky in that way that it doesn't matter, because especially brachycephalic dogs, her underbite maintains her structure of her face, so she doesn't look any different, thank God. And of course it wouldn't matter, I would love her no matter what. It doesn't matter what she looks like, but used to being one way, and she realizes there's something different. So she was like, been giving her, she loves yogurt, so we got her honey. She likes the yogurt I like, which is honey vanilla Greek yogurt. So we got her a few tubs of that. So it's nicely soothing on her gums. Everything she's got to eat right now is very soft. So I mash up her food. She insisted I hand feed it to her the first day she was home. Second day, which was yesterday, she's like, no, I want to do it on my own. I don't want to eat from your hand. She ate by herself. I uploaded a recent reel of just kind of like a 1 minute, very quick window into when we brought her home till like recently, till today, and you can see how fast she recovered. But obviously, because her mouth is still all stitched up, they bleed a bit, like it just comes out. So I always like have a towel under her mouth or like a fleece blanket, and I'm doing laundry and just making sure she's got clean blankets and towels to lie on, because kind of like diluted saliva with blood seeps out of her mouth. Normally she doesn't drool, but because she's just had surgery, it comes out a bit. So there'll be like kind of bloody wet spots, like watery bloody spots on the bedding that I will put under her. So that's just normal. I just want to let you guys know. But my biggest warning for this video is that don't fucking buy those bones. Benebone, Nylabone. Thing is, okay, Nylabone does make good bones, the gummy ones. They're like flexible, gummy. They're like soft. You can dent your finger, you can push your fingernail into them. They're hard as a rock. Do not give them to your dogs, because regardless of breed, they're fine until they're not. And the fact that you can Google it and it says it's common, like that's not a good thing. I don't even understand why they sell bones that hard for dogs. And just because it hasn't happened to your dog doesn't mean it can't. Usually people are not aware of it. Some people are so oblivious to the dog's health that they won't realize till years later. And you hear of these women who've never brushed the dog's teeth, which obviously will make it worse if they have any kind of infection. It's going to make it so much worse, because it's just, you're breeding more bacteria in the mouth. And if they have that fracture on top of the infection, and then, you know, causing more different kinds of infections, there's people that get like 25 teeth removed at the same time, like all at once, because they never looked up. They totally neglected the dog's teeth for that long. So, and we've always been so vigilant and took care of her. But so in a way, it's like, I'm glad that it's not because of my lack of parenting. I'm on it, obviously. But yeah, the 2 times she's had infections because this recurring infection from the fractured teeth. So she's had 2 fractures, one last time and another one this time. And the fracture leads to an infection. So basically, the hairline fracture from chewing on hard items, hard bone, leads to an infection, and then it starts spreading throughout the gums and affecting the other teeth. And obviously it weakens the entire thing, which makes them more prone to infections, and the teeth are probably not as strong either, so maybe more prone to fracturing more teeth, like, because basically the infection came back from the first time, and then she had another fracture. So, you know, it's hopefully this time it's gone completely. The fact that they went into her bone to take any kind of like remnants out. She has a few teeth on her left side, and obviously we're going to try and hope that, you know, we're not going to allow her to chew anything hard, and just hope that they're strong enough to not be easily fractured by anything else. So gummy bones it is. Yeah, just make sure that they're soft enough that you can kind of bend them. You'll feel them, they're gummy-ish. The other bones feel hard as a rock, like they've got no give. Just stay away from those, because you don't want to risk it. Someone asked me today on the pugs group, because I had posted the video like warning everyone, like, stay away from these bones, they're not good, blah blah blah. And someone asked me like, which bones do you recommend? I'm like, anything that is kind of soft, you know, the gummy bones, the flexi bones, the ones that kind of have give, you know, the ones that are kind of like they feel like a bouncy ball or something. And I recommend Smart Bones or any rawhide alternative. Smart Bones are Nova's favorite brand. She has a favorite because she's tried different ones. Smart Bones are her favorite, and they make different kinds. They make the knotted bone style, they make like a stick wrapped style, and then her new favorite are these like little woven balls. Let me show you. Actually no, I don't want to get them because she's gonna see them and then she's gonna want one, and then I can't give it to her because she's been not understanding that she can't have like certain treats, and then she realizes, oh, that fucking hurts. Like today she wanted to play because she saw Mello playing, and then as soon as the toy got kind of like hit her mouth a bit because we were like playing, and I felt so bad because it wasn't hard, but because everything is so sensitive, like she's got all stitched up in her gums, right? And she must be in incredible pain, even with painkillers. She's on some heavy painkillers, but even with that, you can tell she's not 100% pain free. Like how can you be, right? It just lessens the pain. But anyway, she was like, oh fuck, you know, and she realized she couldn't like play. So when she felt even the little bit of a touch from the toy to her jaw, she was like, shit. So I'm not going to play with Mello too much in front of her, especially if she wants to play. If she's sleeping or whatever, it's okay. But yeah, I just want to warn all of you guys to stay away from those kind of hard chew bones. Only get softer ones. Rawhide alternative is great. I don't recommend rawhide. Even the oral surgeon, vets will be against rawhide too, because a lot of the time the danger is like dogs usually swallow the last piece. I've had to like, Nova's pretty good with not eating crazy, but sometimes when with rawhide there's a piece that they cannot break down and they'll end up trying to just eat it. And so I've always had to be vigilant when she's getting down to the last bit. She's really good with like not just inhaling the whole thing, but when she gets down to the last bit, it's hard for them to like break that down further. They end up trying to swallow it, and sometimes they're like choking on it. But the biggest problem is that rawhide can clog the intestines and get stuck in their fucking intestines, and then sometimes they have to go to the vet to get like surgery to get it removed, or like it can cause all kinds of GI tract issues and like digestive issues and give them diarrhea for like a week. Like it's not good. But there are so many companies now making rawhide alternative, and they're basically made of like vegetable proteins, chicken, different kinds of meat, and collagen, and it's like a mixture that mimics rawhide, but so much better because it breaks down easier. And then in this system it breaks down easier. It's not true rawhide, it just makes them think it is, so it keeps them busy and they can tear it apart and stuff, but it actually breaks down a lot. It kind of starts to get soft and break down and disintegrate with the saliva. Like you can see it when Nova's chewing it starts to get very soft and break down, and rawhide isn't like that. Like rawhide takes forever to just like chew, and you can have it for weeks and weeks and it's still intact. But like smart bones are designed to be eaten that day. Like they're amazing. I've never had issues with any of my dogs and smart bones, so I highly recommend that brand. So anyway, yes, I just wanted to warn all of you guys, the best way to a dog's health is preventative, right? Instead of trying to fix the issue, it's good to prevent the issue. So yeah, just know that not all gum infections are caused by lack of hygiene, because her hygiene's really great. Yeah, the hairline fracture thing, so that's the thing. Anyway, I will see you in my next video, and I love you all. Mwah. Bye.